Good evening, everyone. This is Dr. Manu Krishnan K, and let's begin with our today's session, the middle ear cavity or the tympanic cavity. Introduction. The tympanic cavity or the middle ear cavity is nothing but a narrow air-filled space that is situated in the petrous part of the temporal bone between the external ear and the internal ear. So you will be familiar with the external ear and internal ear. So today we will be discussing only regarding the middle ear or the middle ear cavity. And the middle ear cavity resembles a six-sided box. So it's more like a cube, which is more specifically can be related to that of a matchbox. You have seen a matchbox and it will be having six sides, and the further dimensions of the tympanic cavity or the middle ear cavity is as follows. So here you can see a rough diagram of the middle ear cavity, and as marked here, the vertical and anteroposterior diameter of the middle ear cavity, it measures 15 millimeter, that is 1.5 centimeters, and vertically and anteroposteriorly, while the transverse diameter differs at different points. So the first one I have marked here the roof. So this is the roof over here. So near the roof, it is having the maximum diameter, that is the transverse diameter, it is 6 millimeter. And in the middle part, you can see the middle part that is at the level of the umbo. So in the last class, we have dealt regarding the tympanic membrane and its parts. So the umbo, where the handle of the malleus is attached to the tympanic membrane, at that particular level, the transverse diameter is 2 millimeter, and near the floor, the transverse diameter is 4 millimeter. So this is regarding the dimensions of the middle ear cavity. Then comes the parts of middle ear cavity. So basically, the middle ear cavity is divided into two parts: the tympanic cavity proper and the epitympanic recess. So the tympanic cavity proper refers to the area that is opposite to the tympanic membrane. So that diagram I'll show you later. So just keep in mind, it is lying opposite to the tympanic membrane, and the epitympanic recess or the attic, that is lying above the level of the tympanic membrane. And further, the middle ear cavity is divided into four parts, that is the epitympanum, which is above the level of the tympanic membrane. Then the mesotympanum, it lies in the same level opposite to the tympanic membrane. Then the hypotympanum, which lies below the level of tympanic membrane. Then the protympanum around the eustachian tube opening. So you'll be like little confused. What is eustachian tube? The eustachian tube or the eustachian tube, that is otherwise known as auditory tube. So that particular tube connects the middle ear cavity to that of the nasopharynx. Okay, so there exists a connection between the middle ear cavity and the nasopharynx, and that tube is called as the eustachian tube or the eustachian tube, as per your kind of pronunciation. So here we have a diagram of the middle ear cavity, a very simple diagram which you can draw very easily. So let's start with the parts. So I have numbered the parts over here. So we'll go with the same number patterns. So the first one, you can see the first one is a bone which is connected to the tympanic membrane, and the bone that is connected to the tympanic membrane is the malleus. So the ear ossicles which are present in the middle ear cavity, which helps in the transmission of sounds. Let's begin with the malleus. It is connected to the tympanic membrane. So the second one will be obviously the tympanic membrane, which separates the external acoustic meatus or external auditory canal from the middle ear cavity. So here you can see the malleus, the second one is tympanic membrane, and then the third one, you can see there are two red color markings, red color lines I have drawn here in this diagram. First one here and the second one here. So the part which lies above the first line, which is above the level of the tympanic membrane here, that is called as the epitympanum. the epitympanum. So the third one is epitympanum. And then the fourth one is nothing but the second ear ossicle, that is the incus. Then the fifth one, that is nothing but the third ear ossicle, that is the stapes. And the sixth one here, that is nothing but the attachment of the stapes, and the stapes will be attached to the oval window, that is oval window here. Then the seventh one is the area which lies opposite to the tympanic membrane, and that is nothing but the mesotympanum. And the eighth one, the area which lies, or the part of the cavity which lies below the tympanic membrane level, that is called as the hypotympanum. So let's have a look into the parts. So you can write down malleus, tympanic membrane, epitympanum, incus, stapes, oval window, the mesotympanum, and the hypotympanum. So these are the respective parts we have marked in the previous picture. So you can draw that diagram and label them with these particular names. The next heading will be the communications and the contents of middle ear cavity. So obviously you know what is communications. What are the connections? So the first communication, which is present anteriorly, is the connection with the nasopharynx. We have previously discussed about that, and that communication is called as the Eustachian tube or the Eustachian tube. So that connects the middle ear cavity to that of the nasopharynx. Then the posterior communication, that is the additus, A-D-I-T-U-S, the additus, which is the connection or the communication with the mastoid antrum and the mastoid air cells. So that second posterior connection is additus, and that is the connection or the communication to the mastoid antrum and the mastoid air cells. Let's have a discussion regarding the contents now. So the contents includes, you have seen the diagram before, so some features I haven't drawn in that diagram to make it more simple. So I'm adding those features here. So the three small bones or the ear ossicles are the malleus, incus, and stapes. Then the ligaments of the ear ossicles which connects between them. Then there are two muscles which are the tensor tympani and the stapedius. So the tensor tympani we have discussed in the previous class, where it helps in tensing up the tympanic membrane. Then the stapedius muscle is the muscle which is attached to the stapes. Then the vessels supplying the middle ear cavity and draining the middle ear cavity, which includes arteries and veins, where we will discuss after a while. Then the nerves, for example, the chorda tympani and the tympanic plexus. So these are the communications and the contents of the middle ear cavity. So next comes the most important part. I have told you it is a six-sided box. So obviously it will be having six walls, isn't it? So let's have a look into the six walls of the middle ear cavity. So the six walls are the roof or the tegmental wall, the floor or the jugular wall, anterior wall or the carotid wall, the posterior wall or the mastoid wall, the lateral wall or the membranous wall, the medial wall or the labyrinthine wall. And here also I have included a simple picture. For those who have difficulty in drawing the diagrams, this cubical representation will be much easier for you to draw. So like this also you can just draw the diagrams. So whichever which is convenient for you, that you can choose. So the other one is more perfect, and this one you can use it for easy sketching. Okay. So here, while explaining the six walls, there are some like synonyms I have given. The roof is otherwise known as the tegmental wall. Why these names are there? Because these particular walls are lying in relation to these particular structures, and that's why they are named accordingly. So the roof, the tegmental wall, so the roof is connected to the tegmental part. Floor is like related to the jugular wall. Jugular vein will be passing through near to that floor, so it has got the name the jugular wall. Then the anterior wall is more related to the carotid artery, so it has got the name anterior wall, and likewise for the other walls. So let's discuss each wall separately. So we'll begin with the roof or the tegmental wall. It separates the middle ear from the middle cranial fossa. So the middle cranial fossa is a particular depression in the cranial cavity that we will be learning later when we look into the skull. Okay, and just try to remember, the roof or the tegmental wall separates the middle ear from the middle cranial fossa, and it is formed by a thin plate of bone called as tegmen tympani. The tegmen tympani, and the plate is prolonged backwards as the roof of the canal of the tensor tympani and pierced by the greater and lesser petrosal nerves. So it looks very confusing, right? So to make things simplified, I have made a model here in which you can see the 6 walls except the anterior wall, which I can't show you because the inside, if you want to see that, I have to open up the anterior wall. So I haven't included the anterior wall. So here you can see the cubical shape of the middle ear cavity, and the roof is marked in the red colored rectangle here. So the roof is formed by the tegmen tympani, that is a thin plate of bone. So it is clear for you, right? So we'll have a revision. Here you can see the points. First you have to write how it is formed and what is the purpose, which includes the separation of middle ear from the middle cranial fossa, and the plate is prolonged backwards as the roof of the canal for tensor tympani. It is nothing but a muscle which is present in the middle ear cavity. So the roof is clear for you. Let's move to the floor or the jugular wall. It is formed by a thin plate of bone which separates the middle ear from the superior bulb of internal jugular vein, and an aperture for Jacobson's nerve. So it gives an aperture or an opening for the Jacobson nerve. So here I have just included a diagram or the model which shows how the floor will be formed. So the floor is formed by a thin plate of bone, and it separates the middle ear from the superior bulb of internal jugular vein. So here you can see below that will be the passage of the internal jugular vein. So here you can see the other walls. Here you can see the lateral wall, the posterior wall, then the floor, then the medial wall. So these are the respective walls of the middle ear cavity. So let's have a look into the next wall, that is the anterior wall, which is not depicted here in the model, but you can just imagine. So the anterior portion will be covered by another wall, and that wall separates the middle ear from the internal carotid artery, and that's why it has got the name anterior wall or the carotid wall. And on the upper part of the carotid wall, there is the opening for the tensor tympani muscle, and there is another opening of the auditory tube or the Eustachian tube. So we have seen that there is a connection between the middle ear cavity to the nasopharynx, and that connection is called as the Eustachian tube, and that Eustachian tube is opening into the anterior wall or the carotid wall. And on the lower part of the anterior wall, the superior and inferior carotico-tympanic vessels and nerves are passing. So that is the other relation of the anterior wall. So now comes the posterior wall or the mastoid wall. So the superiorly, the adductus through which the epitympanic recess communicate with the mastoid antrum. You have seen what is epitympanum. That is nothing but the area above the level of the tympanic membrane. So that part communicates with the mastoid antrum through an opening, that is the adductus. So on the posterior wall there is an opening, that is the adductus, which communicates with the mastoid antrum, and through which there will be relation to the epitympanic recess and the mastoid antrum. And the fossa incudis, or the depression which lodges the short process of the incus. So there is a small depression on the posterior wall or the mastoid wall which lodges the incus. A part of incus is like related to the posterior wall, and there exists a small depression that is called as fossa incudis. Then pyramid or a conical projection opening at the apex for the passage of tendon of the stapedius muscle. So there is a conical projection present on the posterior wall which gives the passage of the tendon of stapedius muscle. Then the posterior canaliculus for the chorda tympani is also present on the posterior wall or mastoid wall. So here you can clearly see the posterior wall or the mastoid wall, where on the upper part I have represented with the rectangle, that is the opening called the adytus, which opens into the mastoidantrum. So that lies above the level of the tympanic membrane. This is the tympanic membrane here. So the above the level of tympanic membrane there is an opening which communicates with the mastoidantrum, that is called as the adytus, and below you can see a pyramid. So here there will be a conical projection and at a small opening, and through which the stapedius muscle will be passing. And here I have marked up area called the chorda tympani, that is a nerve which will be coming through here, this opening here. So that is the opening for the chorda tympani. So these are the features present on the posterior wall or the mastoid wall. And this one here is the lateral wall or the membranous wall. So as the name suggests, it is membranous because it is formed by the tympanic membrane, and it separates the middle ear from the external auditory meatus, and it is formed by the tympanic membrane, tympanic ring and sulcus, and partially by the squamous temporal bone. So these are the structures which form the lateral or membranous wall: the tympanic membrane, the tympanic ring or sulcus, then the partially by the squamous temporal bone. So these are the structures which form the lateral wall or the membranous wall. And the apertures are nothing but the openings, that is petrotympanic fissure, and the anterior canaliculus for the chorda tympani vessel, of chorda tympani nerves. Sorry, that is a nerve. So these are the structures which forms the lateral membranous wall, and these two are the apertures or the openings present there. So here you can see the lateral wall. So the lateral wall is formed by the tympanic membrane, then the tympanic sulcus. So all those things will be present on the membranous wall or the lateral wall. So that concludes the lateral wall. So here one more wall is left, that is the medial wall or the labyrinthine wall. So that is the separation between middle ear and the inner ear. So that is an easy explanation that you can give as an intro. It separates the middle ear from the inner ear or internal ear, and it presents with a promontory. So this promontory is a rounded bulging produced by the basal turn of the cochlea. So the turns of the cochlea, you might have seen it in your PUC textbooks. It is a conch shell or a snail shell-like projection. So that rounded bulging produced by the basal turn of the cochlea is called as the promontory. Then there will be fenestra vestibuli or the oval window, and the oval opening posterior superior to the promontory, and it measures 3.25 to 1.75 mm. It's not that relevant, like when you are writing you won't be remembering these small values. So try to write down there is an opening, that is the oval window, otherwise known as fenestra vestibuli, and which will be attached with the stapes. Then one more window is there, that is a fenestra cochlea, that is round window, lies postero-inferior to the promontory. So these are the structures present or the features present on the medial wall or the labyrinthine wall. So the labyrinthine wall you can see here. Here I have made a small mistake because the oval window is supposed to be here rather than here. So I have put an arrow here. So pardon my mistake. So the oval window will be here, postero superiorly to the promontory. And this is a promontory, that is a bulging part formed by the basal turn of cochlea. And here you can see this is the round window or fenestra cochlea. Okay. This is fenestra vestibuli, which will be present actually here, and this is fenestra cochlea. And the blood supply of the middle ear cavity. The middle ear cavity is supplied by the anterior tympanic branch of maxillary artery, the superior tympanic branch of middle meningeal artery, the branch of internal carotid artery, then the petrosal branch of middle meningeal artery. So you can club this, the two second and fourth arteries you can club together. You can say the middle meningeal artery gives off two branches, that is two branches which supply the middle ear cavity. They are the superior tympanic branch and the petrosal branch. Then the internal carotid give a branch to supply the middle ear cavity, and the maxillary artery will also give an anterior tympanic branch which supplies the middle ear cavity. And the venous drainage is to the superior petrosal sinus and the pterygoid plexus. The nerve supply, the tympanic branch of glossopharyngeal nerve, the superior and inferior carotico-tympanic nerves. So these concludes the complete explanations regarding the middle ear cavity. And so I hope you guys understood the topic clearly, and you can also try to make up a peculiar model, which I have tried to make here. Like I have shown you some pictures regarding the walls. So similarly you can try to make up a model. So if you have a three-dimensional view about the middle ear cavity, it's very easy to study. Okay, so try to make the model and try to learn it perfectly. Thank you.